Hi everyone, my name is Dr. Bill and this is Fertility and the IVF series. Today we will be talking about a very important topic called abortion. Okay, I have to say this. Abortion is considered illegal in Nigeria. Abortion is considered a criminal offense, and both the person involved and the person which is assisting is said to have committed a crime and is likely to be punished by the law if caught or when caught. That being said, abortion is only considered legal in Nigeria if the pregnancy poses a threat to the health of the lady carrying this pregnancy. A medical reason to terminate this pregnancy is the only reason that the pregnancy is considered legal for termination. That being said, despite the legal limitations that Nigeria has on abortion, Nigeria still happens to be one of the countries with the highest rate of abortion, highest rate of unsafe abortion globally, according to research and articles. Also, there are some states in Nigeria considered to be some of the states with the highest rate of abortion, states in the south, like Rivers State, for example, and some other states in the south are considered to be some of the states with the highest rate of abortion. Stay with me on this. Now, there are other states, like states in the north, or Kano specifically, has been known to be the state with the lowest rate of abortion. States in the east, some of the states like Anambra State, Bauchi, Nasarawa, and some of the states are considered to be states with the highest rate of unsafe abortion. What does this tell you? That abortion can be safe and can also be unsafe. That being said, let's delve into what abortion truly means. See, the layman term, abortion simply means expulsion or termination of pregnancy that is between 20 weeks to 22 weeks. If you do the maths, it's between 4.5 months to 5 months old pregnancy, all right? And also when the fetus is weighing about 500 grams, all right? Now, through the use of medications or surgery. Now, that being said, when this pregnancy does not pose a life threat to the lady carrying the pregnancy and she intends to still go ahead with abortion for psychological reason, or for career reason, or for whatever reason that other than medical or health related reason, she's considered to have done an abortion and is likely to be punished by law. What does this now mean when a lady terminates a pregnancy that is below 4 months? Sometimes medically we say a miscarriage has happened, but you still say an abortion has been done, whether the pregnancy is between 4 months, 2 months, 3 months, even down up to 6 months or whatever months. As long as this pregnancy does not pose any health risk or threats to her life and she still intends to go ahead with this pregnancy termination, she's said to have committed an abortion. I hope you understand that. Now that we've said that, let's go over to what the types of abortion really is. Now, abortion can be considered to be threatened abortion as one of the types of abortion. Threatened abortion. What is threatened abortion? Threatened abortion simply means, in layman term, that this lady is pregnant and she's having bleeding or pain. Now, I have to say this. Abortion can both be natural and also be forceful or intentional. All right? Natural abortion as a result of maybe a genetic problem with the child or a medical condition with the mother, diabetes, and some of the health issues or health medical related history. Some other infection as well can cause a woman to have miscarriage. That is a natural process. Her anatomy, for example, if she has low blood level and some of other causes which we will discuss, can make a woman naturally abort. Or she can intentionally take medications or go in for a procedure to abort a pregnancy. Now, we are talking about the first type of abortion, which is a threatened abortion. Threatened abortion simply means that this lady is pregnant, she's experiencing bleeding, and also there is pain. There's a likelihood that the pregnancy may terminate, but it has not terminated. How do we know, or how do you begin to suspect a threatened abortion? You're pregnant, or your relative is pregnant, and you start to notice bleeding or some kind of spotting with pain, please, what do? You ask me, what do? Go to the doctor. This is not the time to visit the auxiliary nurse or the chemist or even the midwife. Why do I say this? I will explain later. Go and see a doctor. The reason for this is because abortion can be spiraled to a different thing altogether. 1 minute it is threatened, the next minute it is retained, the next minute it becomes missed abortion, the next minute it becomes a complicated abortion where life is at risk. All right, so please, whatever you experience bleeding, you're pregnant, you experience any kind of pain or bleeding, the first thing to do is not to visit a chemist, it's not to visit a midwife or even an auxiliary nurse. Go to the hospital. I hope you understand that. Okay, the next type of abortion is called the inevitable abortion. Okay, this is abortion. Like I said, all of this can be the natural abortion process. Okay, it's happening naturally. You did not take any medication to initiate this abortion. It's just happening naturally. Inevitable abortion simply means that you started experiencing some changes in your body. You're pregnant. Of course, you have to be pregnant for us to have this conversation about abortion already. Pregnant, you start to experience bleeding or pain, and the process of abortion is already ongoing. The word is inevitable. There's nothing you would have done to stop it. It is ongoing to the point where you start seeing some product of conception, and the process is ongoing. Eventually, it will lead to abortion. Now, in this case, the lady presents to the hospital, a doctor can initiate a medical termination or a surgical termination of that pregnancy. Why? Because it is inevitable. There's nothing you can do. Sometimes, even without doing anything, the pregnancy will eventually abort because it's inevitable. The process that started long time ago, she's been having these contractions or pain or signs and symptoms. Okay? Now, it is to say that it is intention behind the pregnancy termination that makes it an abortion. If you didn't do anything, you were resting or something happening to your pregnancy inevitably, this is not your fault. Nobody's to blame. Nobody has committed any crime. All right. What do you do? This is not the time to visit an auxiliary nurse or a midwife or a chemist to start taking medications or tranexamic acid, as a lot of people tend to abuse. Go see a doctor. Like I said, 1 minute a pregnancy is aborting, the next minute it becomes life or complicated or life-threatening for the lady that is carrying the pregnancy. This is why no abortion is safe under the confines of your home or the home of a doctor, or even if a gynecologist for that matter. It is always the best place to take care of an abortion is in the hospital, which is why you must always go to the hospital. That being said, the next type of abortion is called the incomplete abortion. Stay with me. Incomplete abortion simply means the process has started, the lady is bleeding, she's in pains, some of the products or some of the tissues of the pregnancy pregnancy is already out, some of the tissues of the fetus is already out, but some are still inside. Now, this is another case where the lady presents into the hospital can enable you as a doctor take a decision on whether to terminate the pregnancy after you've done a lot of checks. Once again, this is not the time to visit the chemist or even the midwife or the auxiliary nurse to try your hands on medications, because in some of these cases of incomplete abortion, the placenta can get stuck inside the uterus of the woman's womb and find it difficult to expel. And so, under the confines of your home or the clinic or the chemist where you're going to, they are most times inequipped with equipment and materials to handle differences, which is why you must present to the hospital where all hands are on deck. There are a lot of equipment and experienced hands to handle the situation in case it becomes another type of complicated abortion. Okay. Complete abortion simply means the lady started bleeding some while ago. She was pregnant, she started bleeding, she started having pain. She could literally see the product of conception coming out. And once the product of conception comes out, the pain that she used to feel will probably start reducing. But sometimes the placenta can be stuck. What do I do, doctor? This is not the time to start trying your hands on medications that you were told. Go to the hospital. Don't go to the chemist or the auxiliary nurse or even the midwife. go to the hospital and get this complete abortion sorted out. The doctor will do a manual vacuum aspiration to really check whether they are retained product of this conception or everything is fully out. All right. So the other one is called the missed abortion. Missed abortion simply means that the abortion has already happened. The baby, the fetus is probably already dead, unalived. For some while, pregnancy is not growing. Most ladies notice this when I've been pregnant, but it looks like my pregnancy is not growing. I'm not feeling my baby's kick. You have already maybe had a missed abortion. What do I mean? The baby is not growing because it's not alive. And what do you need to do? Please don't go taking misoprostol or mifepristone and some of these common medications that you have out there, or trying your hands on roots. Why? Because, like I said, 1 minute an abortion is easy to take care of. The next minute it becomes complicated and you're bleeding heavily and you don't even know your blood level to start with. So some of these medications that you're taking, the doctor has to know certain blood level that you have before even that you place on these medications. This is not the time to go to the chemist or the pharmacy or even a midwife, as professional, as qualified as she is. This is the best time to go to the hospital so that they can get you checked and know what is the best means of terminating that pregnancy or getting the fetus and the product of the conception out of you. That being said, now let's talk about abortion in the real sense. Everything I mentioned here is simply a medical or a natural occurring abortion. Now, abortion in the real sense, which is the purpose of this video, is your intentional termination of pregnancy for the purpose of whatever reason other than your health or medical risk. You take pills, or someone advises you that they can insert pills on you, they can give you some certain injections. Please do not oblige, because abortion procedure can be very complex and can be very complicated. It may appear simple, but even it can be very complicated even for the experienced gynecologists and fertility physicians. So this is why when a lady takes the life of the fetus, she stands a risk of taking her own life if care is not taken. All right, so abortion can be done through a medical procedure, which is the use of medications like misoprostol and mifepristone. All right, I believe everybody knows about this. Like I said, a lady does not have to wait till 5 months or 4 months to terminate the pregnancy. She can even terminate the pregnancy once she misses her period. Is this the safest thing to do? No, because it can cause complication in the future. How do you mean, doctor? How can a simple abortion cause complication in the future? Oh yes. Simple abortion, like you call it, can cause complication in the future. Why? Because if you take that medication, especially for the surgical related ones, or even the medical related type of abortion, medical abortion simply means ingesting pills and then the product of conception falls out of you. Surgical abortion simply means that you go meet an expert or a semi-expert or a quack, and then they do a procedure by inserting, different equipment into you to try to get the baby out. Now, let me talk about the medical abortion and some of the complications that we tend to notice as women become wives and want to now mother children and want to become parents. Some of the complications of medical abortion is that it can cause retained product of conception. What do I mean? You feel that, I have taken this medication, I was asked to take this dose of medications to terminate the pregnancy, to get the pregnancy terminated, and so I took the medication and the bleeding stopped. I felt better, the pain subsided because of pain medications I was also given. But some of this product of conception, like the placenta and some of the parts of the baby, can be retained in your uterus. Ideally, when a pregnancy is successfully terminated, ideally, I'm talking about the safe termination of pregnancy, it is wise to go for a series of checks, to go for what we call a pelvic scan, to really see whether the uterus is back to the normal size or whether there are any signs of retained product of conception. even before the lady starts to bleed, see her next period, or before she starts to try for pregnancy. She's allowed to wait for at least 1 month, stay off for any type of conception for at least 1 to 2 or to 3 months before she starts to try to conceive. Why? Because these products of conception take time to come out of her uterus. That being said, this is why it is wise to have a medical expert handle the cases as regards to any fertility related concerns. Also, some of the complications of this medical abortion is it can cause a lot of bleeding. It can stimulate a lot of bleeding too. For some women that already have hormonal problems like the PCOS that they don't know about, some of these medications like the misoprostol and some of these other medications can cause them to start bleeding and bring out those masked symptoms of bleeding that they had before that they did not know. Bring out those masked symptoms and cause issues in the long run. Once again, this is why it is important to have an abortion or any type of abortion done under the supervision of a well-trained medical care expert in the hospital, not in the confines of his office or his home, as we're seeing on social media with the case of Brain Jotter. Sorry to mention name here. Okay, it is no intention of sabotaging anybody's character whatsoever. It is possibly a misconception or possibly a fallacy running around the internet. But this video is to educate, solely to educate and to inform. All right, let's talk about the surgical abortion. Now, surgical abortion simply means that a lady who has probably initiated the abortion process or takes herself to the health practitioner and he does procedures and inserts equipment into her to facilitate the abortion process. Okay. That being said, it is important to note that there are complications in the long run with this surgical abortion. Even when it is safe, you have to be careful. It has to be done by a professional, or else the complications tend to occur later in life when this lady is ready to settle down and start bearing children. It can cause damage to the tubes, it can cause damage to the fallopian tubes, it can cause damage to the ovaries, it can cause damage to even the uterus, it can puncture the uterus, it can cause cervical traumas and a lot of things. It can even cause or damage to the entire reproductive system, which is why you don't just wake up. Even newly trained medical officers are not allowed to do abortion. It takes a lot of training. These things take a lot of training. That is why it is not safe to walk into a clinic, or you hear some people on Instagram or social media telling you they are abortion experts. Oh, come and pregnancy prevention technicians, pregnancy prevention experts, abortion experts, and the rest of them. Please don't follow that. Even as gynecologists and consultants, they don't do abortion in the confines of their offices, of their homes. They go to the hospital because, like I said, 1 minute abortion is simple to do. You think abortion is simple to do. The next minute, the lady is bleeding out and it has become a life-threatening process, and she needs to take blood, for example. She needs to even be transfused with blood. She needs to be under serious supervision. She can go into shock. These are some of the reasons why abortion is never simple. And this is why it is a criminal offense to even both the enabler as well as the victim or the patient. Okay, like I said, this information is strictly for knowledge and information, or for enlightenment. Okay. How do I have mistakenly gotten pregnant. What do I do? Or I want to have sex, or I'm not sure. There are so many barrier methods to which you can have safe sex without being pregnant. Oh, come on, doctor, you're a Nigerian. You know these things happen. If it eventually happens, it is wise to see a doctor, not a chemist. Not to take laws into your hand and start taking medication. I hope whatever is happening on social media serves as a warning, serves as an eye-opener to all of us here, because it could be your sister, it could be your relative who is called out, or it could be your relative that who is bleeding out or having complicated abortion case and then dies from it. I cannot start mentioning the number of complicated cases of abortion that we see on a day-to-day basis in the clinic. I cannot tell you the number of infertility cases we see secondary to abortion failures and complicated abortion. Once a woman goes through an abortion, instrumentation, more than 2 or 3 times, there is scarring of her uterus or scarring of her fallopian tubes, which in turn, in the future, predisposes her to ectopic pregnancy. Do you know this? There is a possibility of her having what we call infection in the uterus, choriamnionitis, or some form of puncture. We have had to do removal of a uterus for a 16-year-old young girl who mistakenly had a complicated abortion. Abortion should be done under serious medical supervision and not under the quackery. And so, yes, these things happen. Ladies get pregnant. Things happen. All right? But it is wise to still seek the medical counsel of a professional to guide you on what to do when you are finally pregnant. All right, this being said, once again, my name is Dr. Bill, and this is the Fertility and IVF series. Please feel free to like, share, comment, and send in your questions. I'll be ready to answer whatever they are. Have a beautiful day ahead. Bye.